Now I would like to turn it over to Linda Klein. Ms. Klein is the president of the American Bar Association and is the senior managing shareholder at Baker Donelson, Behrman, Caldwell, and Berkowitz. Following Ms. Klein's remarks, we'll hear from Dr. Andrew Gurman. Dr. Gurman is the 171st president of the American Medical Association and is a practicing orthopedic hand surgeon in Hollidaysburg, Pennsylvania. Please join me in welcoming Linda Klein.
Thank you, David. Fabulous job in your 4th year of chairing this committee. And you know, you only get 3 years to chair a committee in the ABA, and magic happened, and David got 4, and that's because he's done just such a fabulous job. Dr. Gurman, it was a pleasure to meet you earlier today, and thank you for being here, and the presenters and the co-sponsors and the guests. Welcome to the American Bar Association's headquarters for this very, very important program. This is the 6th in a series of programs the ABA has been involved in since 2014, including a very inspiring all-day program at Mother Emanuel in Charleston, South Carolina, just 6 months after the tragic church shooting there. One of today's scheduled presenters, Daniel Webster, was also on that program, but I'm afraid that he can't be with us today. But I know we'll have much to learn from, I guess you'd call him his understudy, Matthew Miller, who is going to lay out a public health framework for addressing gun violence. And thank you, Dr. Miller, for joining us at the last minute. Today is just the latest chapter of the ABA's 50-year history addressing gun violence. Our work in this area can be traced to the assassination of President Kennedy. A notable aspect of the assassination was that Lee Harvey Oswald obtained the rifle he used through an unregulated mail-order purchase. Following the assassination, the American Bar Association's House of Delegates created a very high-level task force to consider the issue of national gun violence legislation. The task force resulted in the first comprehensive ABA policy statement on gun violence. And many of its provisions related to prohibited gun purchasers and mirror what finally became law with the Gun Violence Control Act of 1968. Since then, the ABA has had a succession of groups that address gun violence, including one of today's co-sponsors, the Standing Committee on Gun Violence, and you've met its chair, David Clark. Over the years, the ABA has adopted more than 20 policies related to stemming gun violence. Our policies support the regulation of firearms, including military-style assault weapons and high-capacity magazines. We call for enhanced background checks. We support the strengthening of criminal and civil enforcement remedies. We promote education and prevention, including increased funding for research to support the reduction of firearms-related injuries and death. Our most recent policy on gun violence opposes government efforts to limit the ability of healthcare providers to discuss firearms with patients. Some refer to it as docs versus Glocks. The ABA followed up with several amicus briefs in the 11th Circuit where this was being litigated, and the topic is going to be discussed on a panel this afternoon. I'd like to mention a very prescient ABA policy that we adopted more than 20 years ago. In 1995, we urged leaders of the legal profession to join and work with our counterparts in the medical and other professions to reduce and prevent gun violence. This gathering bears witness to that calling. Among other things, our policy called on lawyers to educate the public and lawmakers regarding the meaning of the Second Amendment. In 1995, the Second Amendment was understood to link the right to bear arms with a well-regulated militia. Professor Miller will discuss the Supreme Court's subsequent decision in Heller and what, if any, impact it's had on our efforts. Now let me raise 2 questions. Why, in the more than 50 years following the JFK assassination, does the ABA keep at it? And why has the ABA embraced public health approach to this crisis? In answering the first question, I'm comforted by the fact that lawyers care deeply about what happens in our communities. Lawyers who can care include prosecutors who firsthand see the ravages of gun violence. Lawyers who care include those who formed a coalition of large law firms to provide pro bono services to gun control groups. Lawyers who care include leaders like John Lowy of the Brady Center, who have dedicated their legal careers to this issue. And lawyers who care include countless numbers who volunteer their time and energy working with civics groups to combat gun violence. I'm pleased that today's co-sponsors, in addition to the ABA Standing Committee on Gun Violence, include the ABA Committee on Youth at Risk, our Criminal Justice section, our Health Law section, our Litigation section, demonstrating the breadth and depth of concern throughout the entire American Bar Association. Also among the legal organizations supporting this event and working diligently on these issues are the Illinois State Bar Association and the Chicago Bar Association. I see Executive Director Bob Craighead here, and I think Terry Murphy, the other Executive Director, will be with us today. And as to why we support the public health approach, I recall a series of public service announcements that began with the expression, "the more you know." If gun violence was just about criminals and bad people, then we could leave it to the courts to resolve. But the more you know, the more you realize that gun violence runs much deeper than criminal behavior. Suicide alone, for example, accounts for the largest share of gun-related fatalities in America. To truly address gun violence, therefore, legal approaches must work in concert with promoting public health. If I have a parting message, especially for the healthcare professionals in the audience, it's that we will not quit. We are honored to be here with you, and I'm delighted to share the stage with my counterpart at the AMA, Dr. Andrew Gurman. Thank you all for being here this afternoon, and thank you to our speakers and sponsors for the commitment you have made to stem the scourge of gun violence that plagues our communities. We will work together on this problem, and together we will make a difference. Thank you so much, Dr. Gurman.
Well, good afternoon, and thank you for taking time out of your busy schedules to be here. We very well know what the ABA has been doing, but it's nice to hear it. So thank you for that brief history. Thank you for taking time for discussion about an important and urgent public health issue. There are few issues today that are more vexing, more heartbreaking than the scourge of gun violence in our communities, in our cities, and across the country. In short, that's why we're here. We cannot begin to ease the threat of gun violence in America without a united front. Without leaders from the medical community, the legal community, the criminal justice community, and others locking arms together and pulling in the same direction. This summit gives us an opportunity to do just that, to discuss, debate, and collaborate on meaningful solutions that could reduce and perhaps one day even prevent gun violence. So thank you to all of the partners who've made this event possible, not only the American Bar Association, which has fought a very public battle, as you heard, against gun violence for many years, but others in the legal community represented here as well. When public safety is threatened, when lives hang in the balance, it's imperative that we all work together. Thank you also to the medical community that has joined us in rallying around this issue. Now, I know there are a lot of names here, but they do such tremendous work, so I think it's important to acknowledge them. Thank you to the Illinois State Medical Society and the Chicago Medical Society, and also to the 7 national specialty societies that signed on as co-sponsors of this event. They are the American Academy of Family Physicians, the American Academy of Pediatrics, the American College of Emergency Physicians, American College of Surgeons, American Congress of Obstetricians and Gynecologists, the American College of Physicians, and the American Psychiatric Association. Your presence here today and your support of this underscores the magnitude of this crisis. And for the physicians here today who are AMA members, thank you. Your membership and support make advocacy efforts like these possible. For those of you who are not AMA members, we ask that you take another look at the AMA and add your voice to these and other efforts across healthcare. Feel free to ask one of the AMA staff here for more details, and there is literature out on the table, and we will be happy to get you signed up today. Physicians, nurses, and emergency responders witnessed the aftermath of this violence firsthand. We experienced the frantic, life-saving efforts as they play out behind the scenes, and we see the profound anguish of families and loved ones when our efforts are not successful. For physicians and the medical community across the nation, the threat of gun violence is not political, it's personal. Last summer, hundreds of physicians from around the country gathered at our annual meeting in Chicago at the Hyatt, just a few blocks from here. Every specialty was represented: emergency room docs, family medicine, internists, orthopedists, my specialty. It was at this meeting, our largest of the year, that we first heard about the horrific nightclub shooting in Orlando. 49 dead, families shattered. And though we were some 1,100 miles from the shooting, the pain we experienced as a community was palpable. And as a group, we were determined to aid the recovery in whatever way we could. So when our House of Delegates convened the following day, physicians across specialties spoke movingly about their personal experience with gun violence. These were physicians from big cities and rural communities, each of them sharing heartbreaking accounts of the impact of gun violence on their patients. The victims they treated, the lives cut short, and those forever changed. Afterward, our House of Delegates approved policy nearly unanimously to expand its longstanding policy on gun safety to support waiting periods and background checks on all firearm purchases. The previous policy had supported waiting periods and background checks exclusively for handgun purchases. In addition, our House joined other leading health organizations in singling out gun violence in the clearest possible terms, calling it a public health crisis, one that requires a comprehensive and far-reaching solution. Let me be very clear about this. We are not talking about Second Amendment rights or restricting anyone's ability to own a firearm. What we are talking about is a public health crisis that our Congress has failed to address, and this must end. As a community of medical professionals, it is essential that we work with them to find common ground. As physicians, we rely on evidence-based approaches to problem solving. It is unfortunate and indeed counterproductive to discourage even the most fundamental research into gun violence, as thousands of Americans are killed each year, 33,000 to be exact. An epidemiological analysis of gun violence is vital so that law enforcement and sister agencies may be able to prevent gun violence before it occurs, and so that physicians, nurses, and the medical community can better respond when it does. Solutions to gun violence will not be found until we understand the depths of the crisis, and this requires extensive research. That's why the AMA has and will continue to press Congress to clarify that the Centers for Disease Control and Prevention is in fact allowed to research gun violence and to provide funding to enable the CDC to do so. America's physicians, indeed the entire medical community, must lend their voice and their considerable political muscle to force lawmakers to examine the crisis and to take appropriate steps to address it. The fact is that gun violence is no different than any other public health threat. The more we study it, the more we understand it, the more we can perhaps predict its outcome and its occurrence and who may become a victim. 2 articles published this year in the Journal of the American Medical Association give us clues about how this could be done. Both of these studies were done here in Chicago, a place we know bears witness to the extent of gun violence in this country. The first report demonstrated how firearm violence is actually transmitted by social interaction through networks of people. This is simple. The more people in your life or in the lives of your acquaintances who own guns, the more likely you are to become a victim of gun violence. Because of this, according to the study, it is possible that the same predictive models that we've used for a half a century to limit the spread of infectious diseases, including things like HIV/AIDS, could be used to limit the spread of gun violence. The second study looked at whether predictive modeling in this case using associations of people who were arrested together for the same offense, could determine who one day might be shot or killed with a firearm. Now look, I understand that this may be an uncomfortable discussion, particularly if you come from a community like I do, where gun ownership is the norm. It is also an uncomfortable discussion for those of us who are very concerned about privacy issues. But what is irrefutable is that the scientific research and data can and should be used to help us come up with solutions to reduce the number of people killed or seriously injured each year by firearms. The AMA will celebrate its 170th anniversary later this year, and throughout its history, we've been leaders in addressing urgent public health issues, consistent with our mission to promote the art and science of medicine and the betterment of public health. Following the tragic school shooting in Newton, Connecticut in 2012, the AMA sent a letter to President Obama and congressional leadership expressing our sincere grief and sadness over the senseless events and offering our expertise and our experience to find workable, common-sense solutions to reduce the epidemic of gun violence in America. We noted that the relatively easy access to assault weapons, semi-automatic firearms, and high-capacity magazines, as well as high-velocity ammunition, heightens the risk of multiple gunshot wounds and severe penetrating trauma, resulting in more critical injuries and deaths. Even for those who manage to survive a shooting involving these weapons, the severity and lasting impact of their wounds, both physical and psychological, can lead to devastating consequences for the families affected and to society in the form of higher medical costs. We called for renewing and strengthening the assault weapons ban, including banning high-capacity magazines, as a step in the right direction. We also called for more resources for safety education programs that promote the responsible use and storage of firearms, noting that part of ensuring firearm safety means that physicians actually need to be able to have frank discussions with their patients and the parents of patients about gun safety issues. And you mentioned this in the Dox versus Glocks case earlier. That's why we led the effort in Florida to overturn their gun gag law. Thankfully, an appeals court overturned the law in February, but we know that this is an ongoing fight. Information, particularly in the fields of medicine and public health, simply saves lives. And studies have shown that patients who receive physician counseling on gun safety are more likely to adopt safer practices for storing and maintaining their firearms. And because mental health and substance abuse disorders are so often a factor in gun violence, the AMA also urges increased access to and funding for mental health services, including screening, prevention, and treatment. We've also long sought a national educational campaign to help reduce the stigma associated with substance abuse and for those seeking mental health services. The AMA is a proudly bipartisan organization, and we are committed to working with party leaders on all sides of the issue on meaningful solutions for this urgent public health threat. Thousands of men, women, and children are dying needlessly while the political bickering and finger-pointing persists. We cannot be a country that accepts this kind of violence as status quo. We must work harder, we must work smarter, and most importantly, we must work together to limit the threat of gun violence and to reduce the casualties for a generation at risk today and for generations to come. So thank you for coming. A couple of housekeeping issues. The magic number of 1,000 was given to you, but for those of you who don't know what it all means, there's a sheet out in front for the docs in the audience that has the website where you can go and you can claim your CME credit. I have mine. Also, protocol dictates that I normally would sit in the front row. There is, however, a bit of kabuki theater going on in Washington, D.C. this afternoon, as some of you might be aware, and I think that I may have to step out and deal with that. So I will be back. I will be here for all of the afternoon. I will be here for the reception, and I look forward to our comments, but in order not to be rude and getting up and down, I'm going to sit in the back. So thank you very much.